Welcome back to the EDS Scan Data series. In this video, we'll walk you through the proper way to scan implant locations for full mouth restorations. This demonstration will show you how to use the EasyRef system developed by EDS. Alternatively, EDS Labs works with all other major implant location systems. EasyRef is a game-changing intraoral scanning workflow designed for any standard 1.4 multi-unit abutment system. Whether you're new to the workflow or looking to fine-tune your technique, we'll cover the benefits of EasyRef, best practices for scanning, and common mistakes to avoid. Refs should be placed side by side, ideally no more than 20 millimeters or about 2 centimeters apart. This allows the scanner to capture adjacent references in a single frame. If both scan bodies are visible in the scanner lens at once, you're at the correct distance. With 6 unique shapes designed for any implant location, selecting a ref is simple. Just choose one long enough to establish a clear scan path between adjacent positions. Scan across the arch in a smooth, uninterrupted motion, ideally completing the pass in 15 to 20 seconds. A quick scan time minimizes scan data errors and ensures neck-to-neck alignment, which is critical for spatial accuracy. Scan bodies placed too far apart result in missed captures or distorted geometry. Always ensure adjacent refs are within 20 millimeters. Neck-to-neck alignment of scan bodies is crucial. If misaligned, stitching errors occur and require remakes. Ideally, place the horizontal scan plane of each ref along the ridge or angled lingually. This method is designed to help you integrate digital implant workflows seamlessly, saving time, reducing costs, and improving accuracy for full arch restorations. If you have questions, contact us using the information on screen. Thanks for watching, and happy scanning.